Welcome back, class. It's Dr. Linder. Let's take a little look at the main blood vessels that actually feed the heart. So remember, the heart is a muscle, and muscles contract, and they need oxygen to do that. So how does the heart pump blood to itself? And then when it becomes deoxygenated, how does it go back to itself to pump to the lungs to get oxygenated again? So let's look at the arch of the aorta, which is here. That's the arch. What comes before it is the ascending aorta. And then after the arch is the descending aorta. If we look at the ascending aorta, you can see the pulmonary trunk is cut a little bit, so we have a better view of this. We can see, number one, the right coronary artery. We can see, number two, the left coronary artery. So these are the two main branches off the aorta, and from those two are all the other branches that are going to come and feed the myocardium and feed the muscle of the heart. So off the right atrium, we can see there's a main branch called the marginal branch right here. It kind of goes down. So here's the right coronary artery, and then right here coming down to the apex of the heart, that is the marginal branch. Now off the left coronary, watch this one, two main branches coming off of it. You got the left coronary coming down. This one wraps around to the posterior, right? You lose it here because it's wrapping around to the back side. That's the circumflex branch. The one that continues down, which they call the widowmaker, that's the anterior interventricular or the left anterior descending. Same thing. Anterior interventricular branch or the left anterior descending. It's the same. That would be this one coming down. Okay, that would be where the interventricular sulcus is. Okay, now if we look at the right coronary comes around, and you can see that it wraps around the back. You can see the color changes because we're looking at the posterior side, and we know that there's an anterior interventricular artery. There's a posterior interventricular on the back side. Okay, so the posterior interventricular branch or posterior interventricular artery, that's coming off the right, and then the left coronary gives life to the left anterior descending or anterior interventricular. Okay, now if we look at the right-hand side, this is the venous side. We have some main veins that come off of it. There's the small cardiac vein. There's a middle cardiac vein. There's an anterior cardiac vein. There's a great cardiac vein. All of those main veins lead into the coronary sinus. So after all the blood is delivered and oxygenated, now it's got to find a way into the venous system, into the small cardiac vein, anterior cardiac vein, middle cardiac vein, great cardiac vein, and they all eventually lead to the back side where the coronary sinus is, bringing all the deoxygenated blood where? Into the right atrium. Okay, great. We'll take a pause here. And when we come back, we will talk about the electrical conduction system through the heart.